Peg Joni, and welcome to Southern Vermont AHEC's Let's Talk podcast, where we explore the people, partnerships, and ideas shaping the future of health in our communities. Today, we'll be talking about National Rural Health Day. Joining me are Andy Lowe, Executive Director, and Anne Marie Day, Chief Operating Officer, both of the New England Rural Health Association. NERHA, as they are referred to, plays a key role in strengthening rural health systems, supporting providers, and giving a voice to the unique needs of rural communities across our region. We'll be discussing the power of rural, the challenges and opportunities facing rural healthcare today, and also talk about your recent $1.6 million HRSA Rural Communities Opioid Response Program grant. So let's settle in and get started. Andy and Anne Marie, it's so great to have you back on our Let's Talk podcast. It's been a while, I think.
It
Yes,
is. We're
great to
glad to
be
be
here.
back.
Yeah. So I think it's been at least not quite a year, but it's always a pleasure. So, Andy, we're going to start with you. National Rural Health Day celebrates the power of rural. From your perspective as Executive Director of the New England Rural Health Association, how do you see that power reflected in New England's rural communities and their approach to health and well-being?
Yeah, Peg. I love the theme of the power of rural because it really is demonstrated throughout our New England rural communities. I think of four C's in this regard: community, collaboration, commitment, and connection. And we know that our rural communities are tight knit. Whether they be in southern New England, in Connecticut or Rhode Island, or in far northern Maine, or in the Champlain Islands of Vermont, anywhere across the region. These are tight knit communities of folks who live together, work together, and dream together. Um, and they collaborate. Our rural communities really are, because they're so close, the collaboration comes naturally to them. And it's health. We think of health in a much broader context than just going to a hospital or a health center. It's all the people involved across the community. The commitment that people have to each other is in our rural communities is one of those strength-based kinds of themes that we think about a lot too. People who live rurally live there because they want to. And the connection they have is a connection to each other, but it's also a connection to the land and the waters in their regions, and we see this across the area. So there's no question in my mind that our rural communities have a unique power, although they have some challenges too. But they are certainly able to meet and excel in these overcoming these challenges.
Well, that was beautifully stated, Andy. And this is a perfect segue to you, Anne Marie. Rural New England faces distinct challenges, from aging populations and provider shortages to the high cost of maintaining small hospitals. What are some of the most pressing health issues you're seeing in the region right now, and how is NERA helping communities tackle them?
Sure. Thanks, Peg. Yeah, I think I love that it ties to Andy's response about the power of rural because we do have unique challenges, older populations, larger impacts from social determinants of health, whether it's lack of transportation, lack of access to resources, insurance, low paying wages. And I think that impacts all of sort of chronic disease management. We see a lot of high rates of diabetes and CHF and COPD, but also behavioral health issues and substance use issues. So I think the power of rural and how NERA has helped support and address some of those issues is by looking at innovative solutions, and our role has been really training, education, connecting people around some of these best practices and innovative practices. So we have a number of projects and programs, and one we'll talk about more, as you mentioned, the Community Opioid Response Program. But I think our role really as that convener and educator, we've done a lot around, we just actually wrapped up a grant focusing on getting funding into rural communities. So providing technical assistance on identifying grants and funding opportunities, you know, helping them apply, helping them write, helping them learn how to manage some of these grants. And we've also provided direct funding into community-based organizations that focus on addressing some of these social determinants of health, and really lifting up some of these unique and community-based approaches like community nursing, community paramedicine, and whatnot. So we do that through our webinars, do that through our direct technical assistance, and then our conference that just wrapped with over 400 folks from all across the region. We really were able to share some wonderful, innovative opportunities across the region.
Thank you, Anne Marie. I know I'm going a little off topic, and
That's
Andy,
okay.
feel free to jump in too. Let's just talk about the conference, just very briefly. What were some of the highlights that you wanted to share with our audience today about what took place at the conference?
I
I
think
would
for
say,
me,
oh,
go
go
ahead.
ahead,
You start,
Emery.
Andy. You start.
I was going to say, um, it really does get back to this concept of connections. That to me, that was the biggest thing. We have people coming from so many different um, areas of focus and environments. We have people from critical access hospitals and rural health clinics. We have people from behavioral health and primary care. We had a lot of people representing oral health, public health, universities, and you just can't imagine how these people come together on one roof and make connections. And the connection is around rural and rural health. And anyone who wasn't there can hardly imagine how loud the room gets when these people start talking to each other.
I bet.
Emery.
Yeah, I think for me, I think it's just seeing the passion and the strength in person. We had over 60 breakout sessions, as I said, to share some of these solutions and projects and programs that are happening. And the folks were so excited to be there and continue the conversations that they all ran over. Like we sort of had to kick them out of the room because it was time to move on to the next segment. But people were just so excited to learn from each other, share about their work, and connect.
Yeah, that's very it's good to hear. Rural's not going away. You know, rural health, rural communities. I mean, this is something that's going to be always around, and we always need to kind of come up with innovative ways to just make it better. And NERHA plays such a pivotal role in that. Um, Andy, as we look toward the future, what priorities or policy changes do you believe are most critical to sustaining and improving rural health across New England? And how can community members and leaders get involved in advancing that work?
Peg, I think everyone's aware of how some of the things going on at the federal level are affecting rural health and healthcare delivery across the country, and it's particularly true for rural health. We have a lot of challenges. There have been some disruptions in funding and so on. I'm a firm believer that this is only making us stronger, and we're finding that we can do so much more with perhaps less money than we had before, and it just comes back to the ability of rural people to work together. There's a program that we're in the middle of learning about and hopefully deploying, called the Rural Health Transformation Program, which was announced a few months ago in the wake of the big budget bill. And this basically is the Rural Health Transformation Program, or RHTP, is going to be putting $50 billion, that's billion with a B, towards rural health across the country. And the kind of the short story is that each state is going to receive at least $100 million a year for the next 5 years for rural health.
Wow.
And all 6 of the New England states have worked on their applications. They had an incredibly short time frame to get into it, to get them in. Our state offices of rural health, which are such strong partners for us and do so much work, we're highly engaged in this process, and they've done a fantastic job. Well, we'll wait to see what the program actually looks like as the money starts to come out. But the great thing is the various states are now making their at least portions of their applications available on their websites, and I would encourage people to look and see what they're doing. But the great thing about this is, for the first time in recent memory, and maybe one of the first times ever, each of the states has come up with a comprehensive plan and strategy for rural health. And so, how that unfolds is going to be really exciting to watch. But it's going to center around things like workforce, around increasing access and use of some of the exciting technologies coming along. It's going to do some funding to provide a backstop for some of the funding that we're losing through some of the Medicaid cuts. So there's going to be some direct work and payments going to providers and things like that. But there's also going to be some truly transformative work, and we are hoping to be involved. We at NERHA are hoping to be involved to do some of this work at the regional level. So that's really exciting. And as to some of the other things going on right now, telehealth flexibilities are something we're keeping our eye on. There was some erosion with the government shutdown and some of the flexibilities that came out during the COVID era. Medicare Advantage is being a challenge for a number of our small hospitals and clinics because of reimbursement rates. Everybody talks about workforce and so on. So those are some of the big areas we're watching, and we would love people to get involved with us in terms of things you can do. We at the Rural Health Association have a Policy and Government Affairs Committee. We'd love to see people join us there every other month and talk about these things. The National Rural Health Association has a Policy Institute coming up in February with Capitol Hill visits and so on. And one of the things we're hoping to do is help coordinate some of those efforts. And we're doing work with groups such as the New England Public Health Training Center on a Rural Health Leadership Institute, where we're working on some of these really thorny issues and trying to equip the emerging leaders for rural health in the coming years to be aware of how important it is to be able to communicate and advocate effectively.
Excellent. Anne-Marie, did you want to add anything to that?
I think Andy covered it pretty extensively, but yeah, just start with signing up for our newsletter. We share out a lot of these policy updates and our committee meeting information. So even if you're not an expert, but you're just, wanting to get started, we had a whole panel at our conference on this issue. And I think people want their voices heard and they want to participate, but maybe are just a bit nervous about how to get started. So happy to support folks in that and really encourage people to join in. We always say, your voice is louder. That's NRHA's anthem. And so the more they hear from us, the better.
That's right. So question is to both of you. You've dedicated your careers to advancing rural health in New England. What originally inspired you to work in this field, and what keeps you motivated as you continue advocating for rural communities today?
For myself, I've lived rurally my entire life. I can't imagine living anywhere else. And I'm personally very closely connected to the land and the woods and the waters and so on. And so it was a natural step in working in the healthcare field for me to move into the area of rural health. I spent a number of years working with the state of Vermont and the Agency of Communities of the Agency of Human Services, with the Department of Mental Health, the Vermont State Hospital, and so on. And then on some rural health programs at the University of Vermont before working at a rural community health center. And it was just once I really started getting involved with the New England Rural Health Association, then I realized it was like this epiphany. It's like somebody's actually putting rural and health together, and there was no looking back. I spent a number of years on the board, and it was just kind of a dream when the opportunity to move into working at NERHA came along.
All right. And Anne Marie, your turn.
I think for me, I've always wanted to help people, and I got my start working at my local community health center in my hometown. At that point, I didn't really recognize it as rural health. It was just all I knew. Like Andy, I've always, lived and was born and raised in a rural small town, and so just thought that's what it looked like. But as I sort of explored advancing my career, that I could make a difference at a larger level, whether that's impacting policy or supporting the region and making connections across state lines. That was just something that really spoke to me, and actually presented at the NERHA conference in my former with my former organization, and then just felt like I was surrounded by my people. And so from there, it was just a great honor to join in this work and help grow what we have today.
Well, thank goodness that NERA has both of you at the helm, because
Thank you.
you guys have really advanced this. Their innovate, uh, all of the wonderful work that you're doing is rooted in your commitment and your passion. So
Thank you.
kudos to both of you. And Andy, and Anne Marie, I want you both to share this. Congratulations on receiving this incredible grant, $1.6 million. Uh, can you tell us about the goals of the Northern Border Rural Workforce Grant and what this award means for NERA and the communities that you serve?
It was a great opportunity when it came along through the HRSA, the Health Resources and Services Administration, Federal Office of Rural Health Policy, in the Northern Borders region. And we identified immediately that this fit in with our commitment to expanding and strengthening the rural health workforce. That really is the goal of the project, and specifically in the area of behavioral health, and even more specifically in the area of opioid use disorder treatment of that. So what we're doing is working with the Franklin Pierce University School of Physician Assistant in Lebanon, New Hampshire, and with two AHECS, Area Health Education Centers, the Vermont and New Hampshire Health Education Centers, southern and northern regions, to support physician assistants at Franklin Pierce over the next 4 years by providing them with specific training about medication-assisted treatment for opioid use disorder, substance use disorder, and that focuses on both their classroom education in the first year of the program, and then their experiential practice in their clinical rotations in the second year. And our friends at the AHECS, the Area Health Education Center, are so good at working with the healthcare providers in their local areas, and they know them so well. We're really leaning on the AHECS to help expand the number of sites where we can have students placed from Franklin Pierce for rural rotations, and then ultimately for practice to be practicing. So that's how we're going to expand that. So what it means for us is it helps us really further achieve our mission in terms of strengthening and expanding the rural health workforce. And the rural communities in Vermont and New Hampshire, we are going to see an increase in the number of providers that are able to successfully treat substance use disorder.
All right, excellent. Well, as someone who works for AHEC, we were so thrilled to be part of this. And Anne Marie, this grant, as Andy said, focuses on strengthening the behavioral health workforce across rural Vermont and New Hampshire. And it's a region that's facing serious workforce shortages. What are some of the biggest challenges these rural communities experience when it comes to behavioral health access, and how will this funding help them?
Yeah, I think as Andy mentioned, this will really be training the physician's assistants in a number of different community settings in rural communities. So there's a huge workforce shortage in primary care, and I think that is so needed. These PAs will be really well trained, not just in overall family care, but adding in that behavioral health component, um, integrated care into the primary care setting, and how to treat substance use. And so I think for this in rural communities that there's no wrong door, whether they're accessing and reaching these PAs in primary care, they're going to be placed in some emergency department rotations, so treating patients right in the front door as they where they're meeting patients where they're at, I guess is really the goal. Or if it's in direct treatment service centers across Vermont and New Hampshire. So really just hoping to get these physician assistants to stay in the region, to experience this and see that it is able, it is a chronic disease and it's able to be managed within a rural community, right in a primary care setting, and to give them those tools and services that they'll need to meet this rural communities' behavioral health needs. So we're really excited about that. We think it'll meet a great need and also just provide a huge boost to the workforce in these rural communities.
Well, eventually, and again, I don't want to go too off topic here. Will eventually this encompass social work as well? I know the focus right now is on
Yeah.
physician assistants, but I'm just
Our
curious.
program is, where there's actually other Northern Border recipients of the RCORE grant. So we actually had a meeting with the other New Hampshire grantees, and some of their programs are focused on different parts of the care team, social work, peer recovery. So it really is supporting the whole care team in different aspects. So each grantee has sort of a different focus and area of training.
All right, excellent. And Andy, looking ahead, what does success look like for this project? And how are you going to measure impact? And what changes do you hope to see in rural behavioral health services across Vermont and New Hampshire because of this grant?
Sure, Peg. I think as Amory and I both have said, the success would be uh, expanding that rural health workforce and strengthening their capacity. We are hoping to train more than 100 physician assistant students over the 4-year term of the program. And success, I think, takes on it's not just putting these new providers at rural clinics and hospitals, but it's creating an interprofessional, strengthening the interprofessional relationship of the entire care team by strengthening some of these folks and getting them into the rural communities where they can serve. We're also strengthening the people around them because they're going to bring new practices, new models of care, which are going to help everybody. We're really leaning on our AHEX to track the student placement and retention, the placement both in for clinical rotations and ultimately in practices where they'll work, hopefully, and that's AHEX. That's the work they do every day, every year, and they're so good at it. Uh, we're going to be hoping to, of course, strengthen the overall substance use disorder and opioid use disorder capacity, but um, I think one of the things, maybe one of the hidden benefits of this program, is that the preceptors in the sites where the clinical rotations happen, these are mentors. They're clinical staff who work with these PA students, and precepting has a real benefit. We know everybody's is feeling stress from having to do more in less time, it seems, and so on. And we hear about burnout daily. Precepting, serving as a mentor and an advisor to these students, is one of the real things we can do as an antidote to burnout because it's stimulating, working with these young, enthusiastic, bright students. I've done this a lot myself. It just makes you feel so great at the end of the day. And so one of the things we're really hoping is to increase the number of preceptors we have out there and have them get the benefit of this. One of the areas, I think, another hidden area people don't think about, maybe top of mind, is this is also an economic development benefit. And the Northern Borders Region Commission started off as an economic development initiative, and now it's doing much more with workforce too. But workforce and economic development are intertwined. And by getting more of these students now to be working and contributing in our rural communities is going to help build the economic development. There's obviously all the trickle down. These people are finding housing, they're raising families, they're supporting their local communities. So we see this as a win-win-win.
Yeah, absolutely. And again, Andy, you speak so eloquently about this. Anne Marie, did you have any final thoughts to add?
Yeah, I think I just wanted to hit home with Andy's point on the business case for preceptor sites. We often hear that they don't have the time or the resources to take on a student. But besides just the joy of having them there, Franklin Pierce is going to be providing them with really hands-on, ready to go students. And so oftentimes it's finding a good match, right, in hosting one of these students that they can retain and hire on as a provider. So just the recruitment costs alone for a provider can be huge. But you've already experienced working at this site and working with this student, and oftentimes it can be a great match, and they fall in love with the community and the patients. So I just think it's as Andy said, win-win-win all around for everyone involved.
I absolutely agree with both of you. And we're actually at the end of our program, and I want to thank both of you so much for sharing your insights and for the incredible work you and NERHA are doing to support the health of rural communities. As we celebrate Rural Health Day, we're reminded that rural health is community health. It's about connection, innovation, and the people who go above and beyond to make sure healthcare is accessible for everyone, no matter where they live. If you'd like to learn more about New England Rural Health Association, I strongly suggest that you visit their website. It's NERHA.org, NERHA.org. And to our listeners, thank you for tuning in. Don't forget to catch our podcast. It's available wherever you can find a podcast, actually. Share this episode and join us as we continue to explore the stories and solutions shaping a healthier future for all. Until next time, take care, everybody.
Thanks, Peg.